If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
All right. I thought we were going to be in the studio, but alas.
Yeah, we shifted a day, and so I'm not in Nashville anymore. I'm in New Orleans now, but
all good.
But we connected online. Yeah.
What's the weather like there? Is it hot?
It's hot and like rain, thunderstorms, sunny, and so similar to Nashville.
Similar to Nashville, yeah. Yeah, it's a ton of rain, very, very muggy, and very, very hot. Seems to be most places right now.
Right.
Yes,
exactly.
Weird weather patterns. July of 2026. Well, look, it's a Friday afternoon, and I think you and I both have things to do. So let's not waste any more time. Let's dig in. Starting with Axios on the economy, the Fed saw upside risks to inflation, but disagreed on the rate path. So this is the beginning of Chairman Warsh's work with the FOMC. And it seems like, for the first meeting, there's going to have to be some settling in that everyone's going to have to do, and everyone's feeling everybody out.
Yeah, I think that's right. Chairman Warsh is reducing the amount of information that the Fed sends out to the world, which probably is, I don't know if it's good or bad, but it's definitely what he's going to do for his reign. But this time, with the war in the Middle East and AI, some people think AI is going to cause inflation. I think it's going to be deflationary. The war is certainly inflationary. There's just a lot of moving parts. And so the Fed met and, for 2 days they discussed it, and not much came out of it. There's sort of people on both sides of the fence. So,
Yep.
I think Polymarket looks like there's a slight chance that they'll decrease rates, but it's almost a coin toss.
So there was another big IPO on the Nasdaq, but this was not a U.S. company. It was a South Korean company. SK Hynix was originally priced at $149, but actually opened at $170. So that's a 14% jump. And this is a chip company. So it's the second most valuable company in South Korea, obviously behind Samsung. And more fresh meat for the public markets. The demand continues to grow for all things chips, computing, memory. Now it's not only being limited to the United States. We've got Asian companies launching on the Nasdaq and cashing in as well.
Yeah, and I think it's great that international companies are still finding Nasdaq as the best place to list. And I think you're right. We can't get enough chips. We're in a short supply of chips and memory and basically everything compute because we have all these new ways to use it.
Yeah, I'm definitely hearing emerging stories around innovative companies that are working on how to make all of these technologies much more efficient. I heard something on Limitless this week where they were saying that apparently the inference chips only get to leverage about 40% of their capacity. So there's still some real, bottlenecks and limitations in terms of our understanding of how to optimize our usage of these chips. And so I think that's something we got to watch for. We got to watch for the work that's happening to make everything more efficient, because that could be a very, very sharp downturn. Which I would welcome, quite frankly, because all these chips have gotten far too expensive. But for now, it remains that the demand is very, very high.
Yeah, that's right.
VC deal rundown: Leo Cancer Care secures $65 million to advance upright radiotherapy system as the company preps for an IPO. More and more activity in the growth stage, and more people feeling like the IPO markets are open and ready to go. Exciting.
Yeah, and I didn't know that sitting or standing upright would make that much of a difference, but apparently it has a pretty big positive effect. So I'm not exactly sure what the mechanism is for that, but it seemed like they have good results.
Yeah, and just generally speaking, I'd love to hear about cancer therapies and innovations, advancing and getting more money to commercialize. MeiraGTx scores $400 million from Oberlin Capital to help get 2 gene therapies to commercialization. More proof that biotech is back. This company, MeiraGTx, they actually bought back an asset from Johnson & Johnson, despite the therapy failing to improve vision-guided mobility in patients with X-linked retinitis pigmentosa in a phase 3 trial. But even with that miss, they said that it was clinically meaningful in terms of the benefits. They have a second gene therapy that is tackling dry mouth. And, Oberlin Capital thought these two assets looked good enough to syndicate around for $400 million. So every week now, Vic, it used to be just AI, but I think, was this 4 or 5 weeks back to back that we've had these very, very large rounds in biotech?
Yeah, biotech and pharma both are really, really growing and bringing new solutions to market. This one is over my head technically. I mean, I think Oberlin are pretty good investors, and I'm sure they did due diligence on it. But the two markets seem, at least complex to me. But excited to see it happen.
Yep. Pearl Health lands $110 million to support value-based care for Medicare patients. $50 million equity investment led by Andreessen Horowitz, as well as $60 million in debt led by Trinity Capital. So more VBC health tech out there growing, and Andreessen Horowitz remains very active in the healthcare space.
Yeah, and I mean, we've been hoping value-based care would really show impact, kind of bending the cost curve, bringing better care to patients simultaneously. Pearl is one of the largest ones in the country, so good to see them continuing to grow. I'm still hopeful that will really pay off. Again, the underwriting time horizons are hard for value-based care because you can't get the benefit that quickly, but good to see them growing. They're in 40 states. I mean, it's a pretty broad platform.
Okay, so moving into policy, this is it's not like a breaking news story, but it's maybe illuminating something that's happening that everybody may not be aware of because it's kind of happening in science circles. But this is New York Times. The headline is, "The proposed rule would politicize medical research and scientists are not happy." So it's been a while since we've heard about what's happening over at the NIH and what's happening with grants. But apparently this story is referencing a blueprint that the Office of Management and Budget, OMB, released back in late May that talks about reining in a lot of the government funding that would go to scientific grants in order to advance the president's policy priorities. Look, this is a news story, so it's not quite like down the middle. But the positioning of the story is that the proposed rule will expand political control of scientific and other grants, downgrade the role of peer review, and effectively limit researchers' ability to disseminate their findings and collaborate internationally, among other effects. So I think this is just kind of reminding us that there is still quite a bit of consternation happening at NIH around the changes that are happening there and what the impacts are going to be to the growth of science-based advancements in healthcare. Not really surprising. I feel like we spend most of our time talking about HR1 and the impact to providers and health systems, but the cuts are coming across the board.
I agree. The cuts are coming across the board. And I think the landscape, at least on the Trump administration, we'll see under the next presidential administration what happens. But under Trump, certainly the ability for scientists to just investigate whatever they're passionate about and what they think will have the most impact for the world, that is no longer the mandate. It's sort of research in the direction that Maha wants to do research in. Whether that's right or not right, I think that's where we are right now. And the scientific community, I think, is reacting to that, maybe not surprisingly, as they're frustrated.
Yeah, agree. Why biotech revenue projections won't look as sunny once Trump tax bill hits the Medicaid enrollment. This is Fierce Biotech. And a very simple story. I think there's just like one point in this entire article. But Vic, as we were saying before we hit record, not one that I think I had really thought about. And the point of this piece is that when we have a drawdown in Medicaid enrollment and millions of current Medicaid recipients are no longer covered by Medicaid, that is going to shrink the market of those who can afford to access these innovative biotech therapies targeted at rare diseases, right? So a lot of what's happening in biotech targets rare disease because there's a higher willingness to pay, especially from the government, for rare diseases because they are rare, right? And a lot of the biotech innovations, the economics around them are difficult for mass market, but they're much more easily deployed at rare diseases, right? But generally speaking, I think it's true. If you cut down the number of insured people, you are cutting down the market and you're cutting down the total surface area that's available for these biotech companies to be able to deliver their therapies. And so I thought this was a smart article to sort of point out that fact. And they have several different organizations and companies here from the biotech space sort of saying, yeah, like shrink our insured base and you shrink our addressable market.
Yeah. And I mean, there's no question that a child with a rare disease, we as a society, I think we want to take care of that child, and the vehicle is Medicaid that would happen through. And these work requirements and other requirements are gonna change that enrollment. I mean, that's just so pointing out that it's going to not only affect health systems but also the biotech pharma industry, I think is right.
Yeah, and just something I had not thought about,
right.
And I hadn't heard anyone say before. So I thought it was a good point to bring up, especially like when we're comparing it with this rise in biotech funding and IPOs, right?
Yeah.
More bad news. ACA premiums are set to spike again in 2027. Insurers are proposing a median premium increase of 14% for 2027, suggesting another year of double-digit premium hikes as policy upheaval and rising costs continue to roil the marketplaces. This is Healthcare Dive, and I think the result of this is going to be two things. One, there's going to be more and more people who are just going to go uninsured because they cannot stomach a 14% premium increase along with flat wages, along with inflation, along with, right? I mean, people just cannot continue to have their flat income continue to be eaten away by healthcare that they may or may not need. And so healthcare insurance that they may or may not need. So I think there's going to be more and more uninsured people as that slims out the risk pool, because a lot of people who are going to choose to opt out are going to be the healthier ones. It's going to make the remaining risk pool worse. And that's going to drive a lot of insurers who are still hanging around to try to find the exits. There's already been waves of insurers that have exited the marketplace over the last year, and I expect we'll see even more over the next year. So the kind of a double whammy here between Medicaid and then what's happening to the marketplace. I think we're going to have millions of people uninsured.
No question. I mean, I think the response from the payers of really high MLR of over 90% in some cases last year, I think caused them to increase premiums. And that they need to be cautious with that, because you're exactly right. The healthy people that can decide to go uninsured will. And so their risk pool, the pool of people that are still on the ACA are going to get, more and more expensive and have more and more health issues. And then that might cause them to raise prices again. And you get like in this not good spiral. So we're starting to see that in 2 years in a row of, well into double digits. It was 18% last year, 14% for the upcoming year. That on a pretty big base cost already. That's hard to stomach 2 years in a row.
Agree. Elevance sues CMS after Medicare Advantage stars recalculation. This story seems to pop up maybe every 6 to 9 months. Somebody sues CMS for the stars recalculation. Apparently Clover Health won a case, and Elevance, I think, is seeing that and citing that there was a different methodology used for Clover than its peers, and so they are following suit in filing suit. And apparently Elevance is saying that they lost out on $115 million in bonus payments as a result. And we've talked about this in the past, right? I mean, when these recalculations are done and maybe there's not enough advance notice, $115 million is real money. We just talked about these MLRs, being in the 90s, and in the first quarter, many of these large insurers did the hard work to kind of get their MLRs back down below 90. But 115 million is nothing to sneeze at. I mean, that's a lot of money, and I feel like Elevance probably had no choice, given the size of the missed bonus that suit was required.
Yeah, it should not be this hard. I mean, I like the concept of rating payers and then adjusting their bonus payments or adjusting the way they're reimbursed to reward high quality, a bunch of different metrics that are not purely based on the actuarial tables. But it needs to be consistently applied and sort of fair to everyone across the board. And I think CMS has sort of done different calculations for different groups, and that they lost to Clover. I think Elevance has a pretty good case. We'll see what happens, but they're definitely pursuing it.
Yep. Whistleblower lawsuit accuses alignment of accounting fraud. This is another MA case here. Alignment Healthcare, former Alignment Healthcare executive is accusing the company of accounting fraud that made Alignment appear more valuable than it is, and triggered lucrative bonuses for senior leadership, according to a lawsuit filed on Tuesday in California District Court. Their chief data and transformation officer says he was forced out after discovering that they had misclassified $8 million to $10 million as capital expenditures instead of operating expenses.
I mean, this is finance 101, right? Like the most common way to make your statements look better is to do this, to sort of make it a capital expense, then you amortize it over several years. You don't take the hit this year, and there's a lot of rules about that. So I think if they did that, they definitely should be forced to take it back, and having an internal leader, sort of reporting on them is pretty damning. I don't know the facts of it, but that seems like a difficult situation.
Seems like a hard one, for sure. Moving on to health systems, 10 healthcare bankruptcies in 2026. Becker's Hospital Review kind of tracks these things just to kind of see how the market is doing health-wise. In 2024, there were a total of 15 bankruptcies. In 2025, there were a total of 20 that Becker's covered. And at the halfway mark of 2026, so far we have 10. So it seems like we're keeping pace, unfortunately, with 2025. I don't want to go through the list here, but I think everyone expects that in the coming years, this number is almost certainly going to increase as payments are cut from HR1.
Yeah, that's what I was going to say. Keeping on the same pace as last year, I think, is the best we can hope for this year. Mm-hmm. And I'm pretty worried about next year. Not so much this year, but I think 27 is going to be a really hard year for bankruptcies.
Very hard year. Back on the labor strikes. Brigham Williams Hospital nurses and 450 home health workers launched Massachusetts' largest ever healthcare strike over stalled contract talks on wages and benefits. The strike quickly prompted Governor Maura Healey to step in and convene both sides of the State House, but it remains unclear whether a deal is near. Normally hear about these stories happening out in California. Massachusetts is known for, providing incredible benefits to its citizens and sort of, depending on your philosophy, being a model for operating a great healthcare model. And, but the strikes are hard to avoid, right? I mean, we're really just dealing with the struggles of affordability in America. And every time we try to do analysis on this, it's always larger than the healthcare system's fault. If these very, very critical workers, 4,000 nurses, 450 home health workers, if they're striking, it's because, wages and benefits are not seen to be keeping up with A, cost of living, and B, the absolutely critical work that they're doing. And obviously the strike is so significant that the governor had to step in and try to bring the parties together and try to get to a resolution as quickly as possible. Alongside bankruptcies, I expect that the strikes will continue to happen because we've seen them work, right? I'm trying to think, has there been a story where we haven't seen a strike result in terms that were more favorable for the healthcare workers, Vic? No. I mean, they need these workers, and there's no other choice but to try to come to some settlement. And at least to me, it's very related to the last story. There's incredible pressure on health systems to be sustainable financially, and yet their workers are demanding
pay raises and better environment, better hours in order to keep up with their own cost of living. So just this pressure is coming from both sides to the health system, and it's really a difficult position. I think Mass General Brigham will probably have to settle somewhere, but it's not a sustainable model on both sides. I mean, I agree. The nurses and the home health workers need to be paid enough to live in Massachusetts, where, it's reasonably expensive. And yet, if Mass General Brigham Williams can't figure it out, I mean, that's one of the best health systems in the country. And so we have challenges all around health systems in that.
Close to home, Ascension, St. Thomas, is buying Tennessee system Williamson Health in a $1 billion deal. So, for those who know this market, that would have been pretty competitive. Ascension beat out other offers, including from HCA and Optum, to give Williamson a financial lifeline amid serious challenges facing regional hospital operators. I think, for those who don't know this market, this is just like a little bit of M&A. But Ascension St. Thomas is a very, very important regional system in the overall Ascension health system. This is their innovation system. It's run by Fahad Tahir, who's an incredible CEO. And Williamson does close out a really important part of the geography of Davidson and Williamson County, covering sort of that south side of the city. And so I think this is going to be, a great acquisition. They've got a bunch of different clinics out that way, Premier Radiology, all throughout sort of the south of the city. But they didn't really have a proper health system. So congratulations to them. And I think this will be good for the folks who live out there too, for all the people who call Williamson Health their health system. I think it's gonna be great because they're moving into the hands of a great hospital operator.
I agree. I'm happy to see them join Ascension, and it's going to be great for Ascension too.
Moving into pharma, Vertex, in its largest ever deal, acquires endocrine disease specialist Crinetics for $10 billion. So just sort of scrolling down to the bottom of this story, Vic, this buyout adds to the splurge of biopharma M&A activity in 2026. It's the fourth deal this year of at least $10 billion. Sun Pharma's $11.75 acquisition of Organon, AbbVie's $10.9 billion buyout of Apogee, and GSK's $10.6 billion takeover of Nuvalent. And I think the thing we've noticed whenever we sort of track the pharma industry is they move as a herd, right? Like when somebody makes a move, it's almost like they have to fast follow, right? Or otherwise, I think maybe the stock price gets like dinged or whatever, but it's always like a race to shore up some weakness or make sure you've got a position in a particular area. Vertex seemed to be like way overweight in the cystic fibrosis space. I think it was like 98% of their revenues and their portfolio value was there. And so now they've sort of paid 100% premium on the price. It paid $85 a share, and it was $42 at the close of market on Monday. But now they have an entirely differentiated and diversified portfolio that they did not have last week. So the money is flowing in the pharma and biotech space.
Yeah, I agree. We used to think that a $2 or $3 billion acquisition was, a really big deal, and now it definitely have ratcheted up where there's these four deals, and then this one, they were already public and they had to pay 102% of the current trading price. So it must have been a competitive deal. There's not much information in the article about it, but to pay 100% over the trading price is a really big premium.
Yeah, that's a big premium.
Yeah, and then this is a rare disease, a lot of rare diseases, and so going back to the story we did a couple times ago, that maybe it's going to be challenging in rare disease with Medicaid, putting in the requirements and things. But certainly this acquisition doesn't think so.
Right. That's right. It does seem like there's a little bit of a misalignment there, right, between like the direction on policy and then where the money is going.
Right.
Speaking of policy, inside of pharma, there's now a vote with the Federal Advisory Committee set for the 23rd and 24th of this month, July, that could reshape what's legally available to prescribers, wellness clinics, and patients nationwide around everyone's favorite topic, peptides. or at least Joe Rogan's favorite topic. Listen, as someone who spent, years in the competitive jiu-jitsu space, BPC 157. I mean, I can't tell you how often I heard about that thing getting shot into people's shoulders and knees and things like that. And so, Vic, I can tell you there's a big market of people who cannot wait to get their hands on more peptides, right? Obviously, there's people who already have access to Retta. And I think this is quite frankly just aligned with not just Maha, but I think very personally aligned with RFK Jr. So my expectation is that we're going to have more wide access to peptides in the very near future.
Yeah, I agree with that completely, and I think it's good. I mean, it's already pretty wide. I mean, my wife and her friends started talking about peptides this summer, and they're not on the bleeding edge of high performing athletes, and so when it's filtering into the overall kind of zeitgeist like that, it's out there, and people are buying peptides from anywhere on the internet. I think this could bring regulation and make sure that they're manufactured properly. Hopefully have disclosures about what is good and what the side effects are, kind of like with other drugs. I think it's the right move to start bringing it into the regulatory environment.
Yeah, and look, the other thing is I think this is another one of those things where the downstream effect of this actually happening is more site neutrality, right? And not to say that these peptides are only being offered in health systems today, but I think, the more broadly available they are legally from a regulatory perspective, the more it bolsters a lot of these wellness clinics, right? They become more first-class healthcare facilities, and people will be spending more time in preventative ways, right? More time with peptides, less time with surgery. And so I think this is one of those things where the downstream impact is more shifting the site of care as well.
Yeah, that's right.
AstraZeneca, unfortunately, had a target that missed. It was a phase 3 trial, and WINA, I think is how you call it, did not meet its primary objective. It was not harmful, but it failed to really differentiate significantly against the placebo when treating cardiomyopathy. So unfortunate for AstraZeneca. You always hate to see these trials get to phase 3 and then miss their targets.
Yeah, I think that's right. I mean, it's disappointing. I think we need to cover it when there is a downward move, as well as when there's an exciting successful trial, and so that AstraZeneca has lots of products. They'll come back, but yeah, this was a miss.
A couple of stories here in Health and Us. Normally we only do one, but I think we found two that we just felt were fun to talk about. Yeah. So the first one is about brain interfaces. And I think when we think about brain interfaces, brain-computer interfaces, we tend to think about Neuralink. I think that's for me at least the first association. Yeah. And when I think about Neuralink, I think about surgical implanting, right? So it's going to be some carving that's going to happen to get this chip attached to the brain, right? But this article is talking about non-surgical implantable brain-computer interfaces that are becoming increasingly capable of matching the surgical performance while transforming the risk-benefit equation. And the easiest way to sort of think about this, I think, as someone who has a parent who was successfully had their life saved through this, is aneurysms, right? For a while there, to save someone from an aneurysm, it required a pretty invasive surgery, right? That was opening up the skull.
Yeah. And then if they could do anything at all. I mean, a lot of people
if they could do anything at all. That's right. That's right. If they could do anything at all. And then they found a way to go through the groin and go through veins and drop coils. And that seems to be the model that they have here, right, Vic?
Yeah, that's right. They're accessing. They're still putting the interface of the computer into the brain tissue, but they're not cutting through the skull. They're coming up. I think they're going through the jugular vein, but certainly they could go through other veins like the groin or the arm. And that pathway to sort of access is not well known, but it's several years they've been doing aneurysm treatments that way. And I think it's great. I mean, more activity, more study, more people willing to do it. I think it's really positive. So.
Yeah. So I think this is fantastic.
Like, I don't want to be in the first 20,000, but I'm going to be in the first 20 million that get this. So.
Okay, the first 20 million. Okay, so that's an interesting idea to think 20 million of us will have brain computer interfaces.
Oh yeah, you don't. I mean, in order to keep up with AI, we got to have
listen. I don't even want to have that conversation. I mean, you might be right, but I don't think I want to admit that you're right. Okay. Okay. Healthcare Dive. Physicians' wearable data use is hampered by reimbursement workflow barriers, says a survey. And this survey is from the American Medical Association. So I think the reason why we wanted to bring this one up is, I mean, Vic, how many deals do we see talking about being able to use wearable data? It's talked about all the time in healthcare innovation circles. But you just got to spend enough time with real clinicians and they will just say, and how does it go into the workflow and how do I get reimbursement from it? Right. Mm-hmm. And I think this is something everyone just has to sort of come to terms with, that these wearables are, they're at best at scale behavior change devices for the patient. They are patient empowering. But the idea that somehow they're going to meaningfully increase your physician's, how your physician works with you. I mean, I have a concierge doc, and I've provided them with that data in the beginning, but it's not something my doc asks for a lot, and my doc doesn't even deal with reimbursement. You know what I mean? I think the workflow barriers are huge, and I think also the variance in these wearables. Right? I think we were looking at an article maybe a month or two ago where that one person had
she wore them all for a week. And
the sleep data wasn't the same, the heart rate data wasn't the same, right? You know what I mean? And so when you have that kind of variance, it's pretty hard to treat that as dependable data that you then ascribe a particular method of care against. And so I think we're a long, long way for many, 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 many reasons from wearable data becoming a meaningful source of insight for physicians.
Yeah, so I agree and disagree. I mean, I agree that the workflow barriers are huge. And when we talked about in Massachusetts, there's a strike going on. The workers, the nurses, the clinical staff, the doctors, they are already overworked and overburdened, and adding in a daily or weekly review of their entire panel, or say half their panel, providing wearable data, they don't have the bandwidth for that. That just doesn't exist. Those hours are not there. But I don't agree with you that the variation in the kind of the recording quality is that much of an impediment. I think that, more data and kind of understanding the trends can be really helpful for a physician if we're going to switch to our health system really helping patients stay healthy and stay out of having to have a surgery or having to have a stent put in or having an invasive procedure. We're going to have to figure out a way to design our workforce to be able to work with these patients and help them navigate what their body's going through right now. We just don't have the staff to do it right now. I think the reimbursement is a red herring, kind of like you said. The reimbursement places are in place. We just can't deliver all of the collecting the data, talking to the patient about it so that we can bill, because there aren't enough people.
Don't you think that? So we were talking to one of our colleagues who is under the weather and went to urgent care, and we asked her, hey, do you have a primary care doc? And she was like, they're pretty hard to get. She doesn't have one, right? And I think the reason why she doesn't have one is because the panels are really big. You know what I mean? And most of these primary care docs are overworked with too many patients on their panel. Don't you think that the risk of a false positive is just so distressing to a primary care doc that the idea that because look, you're not going to use the heart rate reading from an Apple Watch. I mean, look, there's plenty of documentation that already says many of these devices don't even read things like heart rate correctly if you have very, very dark skin like myself, right? So right there, you've got all sorts of variances that you have to sort of look out for. Yes, it could be an indicator of something, but let's just look at the practicality of it. if the false positive reading on this stuff is like 10%, let's say 1 out of 10 was a false positive, like what kind of damage could that do to the operations of a already overburdened primary care doc's office, right? So I think it has a lot to do with that. Just like the data is not trustworthy enough to even treat it as a proper signal to take the next step. You know what I mean? Which could mean you're over-treating, or was the care that you offered even appropriate, right?
Yeah, so that's one side of it. I think the other side is also pretty difficult, which is, what if a doc is collecting data on me and they don't really monitor that carefully because they're overworked, and then I have an event and my family says, well, you could have known that you could have solved this, and you were being paid to monitor Mr. Gatto monthly, and yet you didn't follow this data and he died. And so there's a legal liability maybe there. So yeah, these issues are significant. I think these are the things that are preventing widespread adoption. And I guess what I'm saying is that if we're going to migrate our system to trying to keep people healthy, we have to try to figure out some way to work with people and collect data from them and talk to them and learn what they're eating and what their readings are. But our system is not designed for that now. And so that's the challenge.
We agree. All right, moving into Web3. Big week in Web3. Stablecoin firm Circle, hat tip to our friend Dante Disparte, wins a final OCC approval to open National Trust Bank. So this, I think, is the first crypto provider that now operates a bank.
Yeah, it's a landmark deal. I mean, having a bank with a stable coin as their primary kind of business product, and then adding the bank as a second one is a huge change, and I think they're really going to really impact the market. So it's positive. Yeah. It's going to make a big difference, I think.
Yeah, I mean, listen, with this, I think you have to say crypto has gone TradFi, right? I mean,
yes.
We got so much of our information for so long from a podcast called Bankless, and here we have a cryptocurrency company that is now a bank, right? I mean, it's just absolutely crazy. The next story is kind of the opposite direction, right? So SWIFT, which are the old, but nationally controlled rails for international currency transitions, launches a blockchain ledger with tokenized deposit pilot with 17 banks. And so now we're moving in the other direction, right? Cross-border payments. If you remember, SWIFT is how the United States government was able to shut off all payments to Russia at the outset of the Ukraine war. And now we're moving those rails to blockchain. So it's like it's all now merging. It's all becoming one thing. And I think very soon we'll stop even referring to this as crypto, because I just think blockchain as a technology is going to be so fundamentally integrated into all things payments.
Yeah, that's right. It's gonna be kind of similar to, early on a bank, maybe Schwab or one of them had they were the first online banking maybe in the 90s. And now there aren't online banks and traditional banks. They're just banks. They all have online services. I can't imagine a bank not having a web presence. And it's going to be the same with blockchain. It's just part of the infrastructure. It's how they move money around. And yes, the traditional, there's no one more traditional than the SWIFT network. That's like the core infrastructure. And then, sort of launching a blockchain the same week that Circle is launching a bank. I think those two stories back to back are sort of indicative of where we are. It's all merging into one.
And then finally, you and I are constantly talking about market structure and the Clarity Act. And here's our final story from the block. CFTC Chair Michael Selig says regulators will end up writing all the rules for crypto if Clarity Act stalls. And I think he's specifically talking about market structure of turning securities into digital assets. But that to me sounds like a pretty clear warning. Like, if you don't do it, we will. right? Which is so funny because we're at episode 198, reflecting on episodes 1, 2, 3 of Health Further back in 2024, and it's amazing that episode 2 was about the Chevron deference doctrine, right? Which is basically this very issue, which is, should the regulators be making the rules or should the legislators be making the rules? And it's like Selig is here saying, like, we're going to have rules, and so basically if you guys don't do it, we're going to do it. And that just seems to fly in the face of the overturning of the Chevron deference doctrine, right, as we discussed it 3 years ago. But, you know, the rules are really only for my enemy, not for me, right?
Yeah, I mean, the entire Trump administration, I think, Trump 2 is designed to sort of figure out how can we take more control over this infrastructure? How can the executive branch, with the different administrative groups, this CFTC being one of them, how can we get things done not having to wait for Congress? And I agree, he's very direct, sort of saying to Congress, you should get this done. And if you don't, regulators like me are going to write the rules. I think it would be healthy for the elected officials representing all the different, parts of this country formed as the Congress to come up with the right set of rules. But I also have very low confidence they can do anything up there. So,
yeah, we share that opinion. Final stories. We're now into the AI rundown, and not going to talk about this model launched, that model launched. It seems like both OpenAI and Anthropic may be putting the brakes on an IPO, and probably for good reason, because the business model is not at all stable. But this is a different kind of story. I think the story that's been percolating across X and podcasts over the course of the last 2 or 3 weeks has been this rebuke of the business model. A lot of it was spurred by Alex Karp's monologue. The rebuke of the frontier labs in terms of them being able to control so much of how we interface with AI in the United States, and the fact that we need to have access to alternative models. We need to be able to build our own small language models, and we need to be able to host them in our own environments where they keep our proprietary data proprietary and safe, and that seems very, very reasonable. But in order to do that, you're really going to want great open weight alternatives to the big U.S. frontier labs. And the reality is that the United States does not have a whole lot of those. It feels to me like Google's Gemma is probably the best that we've got in open weight models today. And it's good, but the more you get into AI, you understand that lots of models focus on different skills, and Gemma is kind of a general purpose model. And so this story is talking about the plethora of alternatives from all the great open weight AI labs, which are really in China. Your DeepSeeks, your Kimmys, your GLMs. These are Chinese models. And this story from the Wall Street Journal, the headline is, China weighs limits on the AI models American companies love. Beijing talks to top companies about protecting their technology after it wins fans in Silicon Valley. I mean, that is such a rich byline, considering how much Dario complains about the distilling attacks that are coming from even the likes of Alibaba. But just to sort of focus on this story, I think there are two things here. One, there is a U.S.-China AI race that is underway, and I think Beijing is sort of responding to some of the things that are being bandied about over here in the U.S. as we consider what our regulatory agenda is going to be with respect to AI. But also, I think, irrespective of the United States, these AI models are getting incredibly powerful. And I'm sure for a country like China that has so much of a lockdown on their internet, on how people use technology in the country, I'm sure they're getting to the place where they're kind of like, hey, we probably need more controls over this technology ourselves.
Yeah, no question. I mean, America has to figure out how to encourage open source models and have an appropriate regulatory structure. I'm not saying no regulation, but we have to be an open, very competitive kind of landscape like we have with every other technology. That doesn't mean no rules, but we have to encourage open source. I think I like the Gemini models. I agree they're not everything, but they have a role to play. I think NVIDIA's open source model has a lot of potential, but it needs to keep getting better. And I think we should be ready for China cutting us off from a new release of open source models, because that's what I think the right strategic move is for them. Like, why wouldn't they do that? If they have the best open source models, they have very inexpensive power, so their chips aren't as good, but they can layer up, lots of chips in parallel with essentially free power and get to a very competitive, maybe in some degrees better, in some degrees not quite as good as the US proprietary models. We have to encourage open source to complement our proprietary models. And then, if you want to use Anthropic, OpenAI, Gemini, the Grok model is supposed to be really good, the new one, and pay for it, that's the American way. But there needs to be a free source as well, so that we can also have models. I mean, we have proprietary data in our venture business. I don't want OpenAI and Anthropic to have all of those investment rules. So we're going to have some things that are internal, some things that are maybe at the frontier. We have to get our regulatory act in gear.
Okay, Vic, I'm going to call an audible here. We had a breaking story just pop up on the Wall Street Journal, so I want to get into it. Apple sues OpenAI, alleging it stole trade secrets. Former Apple employees took confidential information to OpenAI to advance the AI company's device efforts, Apple claims. I mean, OpenAI is just it's just such a bad faith brand. You know what I mean? Like,
yes,
it's always in the news for the wrong thing.
Yes. And because of that, I immediately believe Apple, even though I have no facts about this story and it dropped 5 minutes ago. My gut reaction is that's probably true.
That's just crazy. Yeah. All right, final story here. TeraWulf signs $19 billion lease with Anthropic for AI infrastructure campus. This is really a data center story, and data centers are just so incredibly politicized right now. I mean, even here in Nashville, Vic, there's our mayor Freddie O'Connell is putting a piece of land under eminent domain, because there's currently a threat that a data center will be set up right next to our Nashville Zoo, and again, it's like, I watched the testimony of the of the founder and CEO of the zoo, and I really did agree with his point. He basically was like, listen, I've been doing this for decades, right? I mean, he founded the thing, and he's like, we have very, very rare endangered species here, and we simply can't take the risk of being an experiment to this, And I thought that was a very reasonable thing to say. It's like, okay, everyone wants to tell us like these things are not harmful, but it's like, but be real. It's like so many things of our time. It's just like GLP-1s. It's just like social media. It's just like AI. Like, these things are experiments. We don't really know, right? Like, Meta is being sued to the tune of like $1 trillion by all these states, because now everyone has decided we do know. Actually, social media has harmed our youth for years, right? But like, you couldn't tell anybody that at the outset of it, right? And so there is an element of experimentation with the acceleration of technology that we're doing. And it's like, can we at least be thoughtful about where we are placing those experiments? So to that point, TeraWulf signs a $19 billion lease with Anthropic for an AI infrastructure campus. They're going to bring 400 megawatts of computing power online by 2028. And, the thing I would just say about this is happening in Kentucky, by the way, Hawesville, Kentucky. The thing I would say about this is, aside from all of the environmental potential issues, we're in a total state of flux when it comes to the AI business model, right? And we're still aping in on these very, very large data center projects. And I'm hearing some really not so, great things about the amount of capacity that's out there, about how much demand Meta's even going to have for their new cloud that they're turning on. And of course, like we said, there's going to be a lot of innovation around how we're going to, get better use out of the chips that we already have, make them more energy efficient. That technology is going to be coming as well. We haven't even talked about quantum. And so it just seems like we're hurling towards this thing without a whole lot of clarity. And somewhere along the line, somebody's going to get hurt.
Yeah, I mean, there's no question we are hurling with very little understanding of, where we're hurling towards. We're just running as fast as we can towards, an AI world that no one really fully understands. But I'll continue to say, like, GLP-1, I think, is a good analog. We don't know what GLP-1 is going to do over a 20-year view to the human body because we just don't have enough data on that. And yet, for individuals, they see the benefit, like within a month, within a couple of weeks, you see the benefit. And then people decide to opt in. And I think the difference with AI is that we really have done a bad job as an industry showing the general population how they're going to benefit from AI. We've done a really good job scaring them about how either the world could end or everyone will lose their jobs. And then we talk about these big data centers that are just going to accelerate that faster. And so it's the same situation, except that the value is much more clear. And I think Meta and social media is another example where it turns out that social media is pretty bad, especially for young brains, young people, before they're fully formed in that kind of vulnerable 10 to 18 period. And the value to them is so high that they're jumping in. That's a very different. Now, Meta probably knew, I think there's a lot of documentation, there's been documentaries and studies about it, that they knew internally that it was causing negative repercussions that they didn't disclose. I think that's why they're getting in trouble for that. And so I don't know. I think it's both ends. Like Anthropic has signed this big deal. They signed another deal with Elon in the whatever his Colossus thing. They have a lot of demand for inference, and they're going to try to grab all this. I think they're going to fill it up. But really, it's a public relations problem or like a value for society question that we're not explaining very well.
Yeah, and look, I agree. I think in the short term, they are going to fill it up. But these data centers are massive. They take up massive amounts of land, and they're long-term going concerns. And I guess the question is, how long are we going to need them?
Yeah, I mean, I think we're going to need them. Because I think a lot of the business world is going to move, let's say maybe half will move to generative technology as opposed to deterministic. And that's going to take a lot of inference. But no one really knows right now. You and I are guessing about that. But yes.
Yeah. It truly is a really, really big bet. And I guess just the final thing I will say, if you've got more, feel free to, weigh in. But, when you talk about GLP-1s, that's a lot more like, my body, my choice, right?
Right. Yeah.
Whereas, with this data center stuff, there are externalities where you don't have a choice. If you're close to these things. And again, I know everyone says they reuse the water, they don't hurt anybody, they don't do this, they don't do that, blah, 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 blah. But I would just say it's not entirely clear. And this would not be the first time where, look, we all have plastics running through our body, right? How long were we told like plastics were fine? How long were people told smoking was fine? You know what I mean? Like it's not even just about the data centers. It's just about the precedent that incentives drive, a lot of mental gymnastics around this stuff, at the expense of other people, right? At the expense of other people. And so I'm not saying for sure this is what's happening. I'm simply saying that we're moving very, 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 very fast in this direction. And there are a million aspects of this that are simply uncertain.
Yeah, I agree with that. And I think that it would be a rounding error for whoever is building the data center to, I don't know, provide $1 billion for the zoo to improve their environments for animals and make it a lot better, or give all the citizens of Nashville free power for the next 30 years, but they're not creating incentives that actually benefit the population. So I don't know why people are surprised that the population is upset. I mean, there's no benefit to me. Maybe it won't hurt the zoo, maybe it will, but I don't want it just because there's a risk of it.
That's right. That's exactly right. Yeah. Maybe it won't, maybe it will, but you haven't given me enough of a reason to take on the risk.
Yes,
that's right.
Right.
That's
yeah,
right.
Exactly.
That's right. All right, man. Go enjoy New Orleans.
Yeah. Okay. All right. Have a good weekend.
All right. You too, man.
Bye.